Your role in diabetes management. Brought to you by Excellus Blue Cross Blue Shield. Diabetes is a disease in which your body either does not produce insulin, does not produce enough insulin, or does not use insulin effectively. Insulin is necessary for the body to be able to use glucose for energy. When you eat food, the body breaks down all of the sugars and starches into glucose, which is the basic fuel for the cells in the body. Insulin takes the sugar from the blood into your cells. When glucose builds up in the blood instead of going into your cells, it can lead to diabetes complications. There are two types of diabetes. In type 1, formerly called juvenile onset diabetes, the body no longer produces insulin and therefore requires insulin injections to treat it. Diet and exercise help control this type of diabetes. In type 2, formerly called adult onset diabetes, the body either has an insulin deficiency or doesn't effectively use the insulin being produced. Diet and exercise, oral agents, and/or insulin are needed to treat this type of diabetes. There are risks you can control and some that you cannot. It's important to be aware of those risks that you cannot control, such as heredity and genetics, but you should focus on those risks that can be controlled. The most controllable risk factors are how much you move and how much and what you eat. These two factors can have a significant impact on prevention and treatment of diabetes. They can also help with weight control, which is important since obesity and type 2 diabetes are highly connected. Let's take a closer look at each of these controllable risk factors. Lifestyle changes have been shown to have the greatest benefit for decreasing the risk of diabetes. Physical activity has many benefits for individuals at risk of or with diabetes. A combination of cardiovascular, strength training, and flexibility exercises can help to reduce or maintain body weight and increase range of motion and balance. Activity also burns glucose and makes your body more sensitive to the insulin you make. It's important to monitor your blood sugar levels. Test your blood sugar before and after exercise. If necessary, eat a snack to keep your blood sugar in a healthy range. If you are at risk for low blood sugar, always carry a source of carbohydrate with you, such as a piece of fruit, so you'll be ready to treat low blood sugar. Always consult your medical team before starting an exercise program, especially if you have never exercised before. Nutrition plays a key role in preventing and managing diabetes. Work with your medical team to design an eating plan that will work for you. Eating should be enjoyable and nutritious. Eating nutrient-balanced and properly portioned meals can help manage weight. Focus on eating whole grains, fruits, and vegetables. Minimize intake of fats and sugar. Always keep healthy snacks on hand and avoid processed foods. Eating a healthy diet requires some planning and preparation, but it's worth the effort. There are a variety of symptoms for high and low blood sugar. People with diabetes may experience them in different intensities depending on how high or low their blood sugar is. If you've been diagnosed with diabetes, the best way to determine if your blood sugar is low or high is to test it using a glucose monitor. Keep a log of your results. It can give you a good picture of your body's response to your diabetes care plan. Be sure to share the log with your medical team. Diabetes increases your risk for many serious health problems. The good news is that with the correct treatment and recommended lifestyle changes, many people with diabetes are able to prevent or delay the onset of complications. However, long-term poor control of blood sugar can lead to serious complications such as retinopathy, which is eye disease and blindness, neuropathy, which is nerve damage, nephropathy, which is kidney disease and failure. Some other risks for people who have diabetes, especially if blood sugars are not well controlled, are slow healing wounds, amputations due to loss of feeling or blood supply, heart disease, dental disease, and greater risk for illnesses such as pneumonia and influenza. To minimize these and other complications, It is recommended you see your medical team on a regular basis and have these tests. You play a vital role in the management of your diabetes. In addition to working with your medical team and keeping them informed of your status, it is important to take care of yourself. Physical activity, healthy eating, not smoking, and taking prescribed medications are essential in preventing complications. For those of you with friends and loved ones with diabetes, being supportive is essential. You can help by picking activities that involve movement, such as going for a walk or bike ride. Also, ask what you can do to help plan for more nutritious meals during an event or the holidays. For more information about diabetes, please visit these websites.